Hello, I'm Dr. Thomas Schuler, Chairman of the Medical and Scientific Board of the National Spine Health Foundation. We're interviewing the top spine specialists around the nation to find out what you can do to overcome your back problem or your neck problem. I'd like to welcome you to Spine Talk Cities 2020. If your problem is bad enough that it's impairing the quality of your life, that you can't do what you need to do, it's critical to stay active, to stay healthy, or you're going to die of a heart attack, or you're going to have some other problem, or just not have an appropriate quality of life.
A constant message weekly to my patients of all ages really is to do everything you can to habitualize physical activity, specifically exercise. You know, we all have our habits. I have my own. I like my coffee. I'll spend 10 minutes a day making it in the morning and enjoying it, but I also like exercise, and I'm a very strong believer that exercise is important, and specifically exercises that work at the core, the abdomen, the back. Stretching the legs is incredibly important, but not necessarily. And I'm not saying everybody needs to go to physical therapy, because physical therapy only lasts maybe 6 weeks to 12 weeks tops. But it's really important for patients to take ownership of the life that they're living and make sure that they're doing the things today that's going to get them to where they need to be later. But also, patients come to you and they're in pain, and you say, yes, we have a solution surgically or not. But I also can tell you that your pain will be mitigated to a large degree in the longer term. You will have less spinal problems. Your spine will degenerate at a slower rate if you lose weight, if you stop smoking, if you exercise, to some degree daily. And those are the sorts of things that I think will lead to a healthier spine and really, and people and patients always chuckle. I mean, the last person you want to see is a person like me. Even though I love seeing you in person, you're better off if you don't have to come to the Cleveland Clinic to see me. But there are ways, but trying to get that, instilled into a patient if they're not used to doing it in a 25-minute or 45-minute session is really difficult. But we do everything we can in our department to make sure that we message, that we deliver we get them started on physical therapy, and we impress upon them the need to do that. But if I can make everybody exercise and lose weight and be the weight that they were when they were 18 to 20 years old, because that's what you probably should be. But paradoxically, we see the exact opposite. And so you would think, well, a patient can carry the most weight when they're young, right? Because their spines and their skeleton are completely healthy. But the exact opposite is true. And so we move through life, we put on more weight, and it really is borne out by the spine. And we see advanced degeneration in patients who carry extra weight. And so if I could do anything in my career, it'd be impress upon enough patients to change that.
But I can tell you regular exercise is extraordinarily important. Keeping your core strong with either physical therapy or on your own. I think eating healthy is critically important. So many of the disease states that we deal with are self-induced. And so the better we can be to our bodies, the less likely, in some cases, there's genetics though, so things are very multifactorial, but I think it's just caring for yourself and have a good balance in life.
But you can really maximize your spinal health by staying in great cardiovascular shape, good nutrition, and really good fitness. It makes a huge difference. You will still be irked by your genetics, but you will have less incidence of back pain. When you have it, it'll be less severe, or neck pain, and you'll protect yourself. So I always say to patients, you're really, really well served by being in the best shape you can.
Please consider giving to the foundation to help support this education and to carry this message of hope to all of those across America.
Spine Talks is a program produced by the National Spine Health Foundation. For more information or to make a donation, visit spinehealth.org.